question, spine question 6A, set 5. Side question number 1. In patient who undergone artificial disc replacement of C5 to C6 3 weeks post-op, discuss the systems, structures, structures that should be tested, assessed that may affecting the patient's problem and condition. So we will be discussing first the brachial plexus, the neck, the cervical motion, shoulder motions, the muscles, and the cervical bony structures that are undergone to the patient. The next structures that should be tested is the cervical motion and the shoulder motion, upper extremity motions, and sensory and motor testing to the patient that should be tested. Assess that may the affected by the patient's problem condition. We will be focusing on the cervical ROM, shoulder, elbow, and wrist and hand. I included them so that they might be affected by the surgical the operation. So testing in myotome and dermatome of the upper extremities. Side question number 2. Patient undergone, give one treatment and goal. So our treatment would be to increase the range of motion, assuming that the patient has already gone with the modalities and pain treatments. We would be doing range of motion movements such as on the cervical and also in the shoulder. On the cervical, we will be doing the flexion, extension, and cervical rotation as per tolerated of the patient. But all interventions are done in a supine position to avoid weight bearing of the head on the cervical structure. Also, shoulder will be doing a range of motion within the shoulder because the muscles that are affected post-op are quite there. So we will be doing a shoulder shrugging, flexion, extension, abduction, adduction. And the next is side question number 3, following this follow-up question on side question number 2. What is your rationale in intervention? I place the patient in a supine position to avoid weight bearing, and also the rationale behind this in a supine position without weight bearing, we would be doing a manual stretching on the shoulder cervical motions as per tolerated of the patient without aggravating the pain too much to the patient. As much as possible, we would be increasing in 1 increments in pain and as the patient could tolerate. And the movement are done because the affected area of the C5 to C6 might be affected and also on the shoulder, so we'll be including the shoulder movements to the patient, and that is all.